Good afternoon, everybody. Welcome to the 6th year of the Professional Care Workers Week, day 1, webinar number 3. To me, this is the most important webinar of this week because this is the one where we have care workers talking about their experiences, hopes, and fears, I suppose. So a very warm welcome, and we are very grateful for your time to Sabrina, Heather, Radina, Clementina, Sylvia, Estella, Leslie, Salvatore, and hopefully Dylan will join us in a minute as well. So we have an hour to discuss things that are important to you. And things that are important to you should be important to all of us in social care. So we are going to record this webinar, and once it's edited, upload it on YouTube to share with as many people as possible. So first of all, I think it would be helpful to say that for me, it would be helpful just to raise your hand when you're ready to speak or if you want to speak. And we'll just start with, can you just briefly tell me what is work in social care right now for you in your role? And also if you could add how long you've been in social care, that'd also be helpful. So would anybody like to start? You can either raise your hand here or raise your hand on Zoom. Either is fine. Right, Salvatore, do you want to go first?
Okay. So I'm just being promoted as a deputy manager for Wolfinch. Okay. I started a real path here in the social care in Italy a few years ago. I've been a manager for an international company, more specialized on catering, but with a side of recruiting and that as well. So then when I come back here, because I've been living here in UK for the last 10 years. I've been just out in Italy for 1 year for personal reason. Then I came back, and then I started the path, I would say 100% on the care system, UK care system on the 2021. Okay. From them, I worked with another company for a little while, and just a little of 1 month. And then I changed it to Wolfinch, where I am. And then I did my certificates, then did my level 2, and then I did and complete my level 5. And that has been possible because I've been working previously in management positions. So that's been joined that. So that is what I'm doing now. And so I don't have a huge amount of years of experience, but working with them an average 50, 60 hours in a week, I accumulated, I would say, a little of experience working from any kind of situation, from dementia, with people with some kind of learning disability sometimes, or addictions, and a lot of people in a major age and so on. And let's see, another good, what could be the next question? Can you hear me?
Yes, Salvatore. So one of the main things I was asking is, what is it like right now to work in social care? So you congratulations on your promotion. So what is it like to be a deputy manager right now?
It's quite challenging on the certain way because we got CQC and the local organization it's right, they demand a lot because we need to get a certain kind of standards, but at the same time I got the feeling that they are everything is starting to be quite, I would say, bureaucratic. Okay, so just right, we need to make a lot of controls. Absolutely fine. Absolutely fine to make any kind of reports, every kind of things, but there's kind of mechanisms and situations that slow our job really too much. Probably with a proper meeting between us as a care provider and CQC and local organization authorities and the probably CEOs companies, that we could probably improve the system because there is a lot to do. and to organize our job in a better, smooth way.
Lovely, thank you, Salvatore. Anybody else would like to volunteer, or otherwise I'll choose. Right, Leslie.
Hello, everybody. I have never worked in care before. I've always been like face-to-face or customer service. I retired last year and got bored, and I had done calls on the COVID line, and it made us realise how many vulnerable people are out there. So when the boredom kicked in, I decided that I wanted to do something in the on the care industry. Luckily for me, I came across Belle Vie, and I've actually loved my role so much that I miss work if I'm on holiday. Never before in my working life have I done that. But it's the people who we look after. They become we've become part of their family, to be honest with you. And I just wish I'd done this role years ago. Yes, it can be demanding role, but when you see the difference that you're making to somebody's life, it melts my heart, to be honest with you. And I speak for all of the staff. I'm a little bit different to Salvatore. My concerns are that we have private clients and we have a handful of local authority. And the reason being is that we are paid a fair living wage. We are paid for our shift, our full shift. If that means we've only got 2 clients in that shift, we're paid that. It's like if you worked in a shop, and if you don't get customers coming in, you're still going to get your salary. So we should all be exactly the same on that basis, that we get paid that living wage, which then allows us to spend more time with the people that need us. We have clients who, the spinster who lives by herself, so lonely, she's in an upstairs flat, she's not mobile. And we've gone in there and we've managed to take her out on visits and changed her life and where she lives, everything like that. And it just, that allows us to do that. I just want the local authority to see, you know, what we can do if they just are prepared to pay that little bit more. You know, it's going to help in the long run for everybody, and it's more importantly for our clients, even though I hate calling them clients. But it is going to help in the long run, and they need to look at the bigger picture. You know, because these people have had falls, been in hospital numerous times. Now that we're calling in and prompting them to be safe, it just makes so much of a difference in their lives and in ours.
Lovely, thank you very much. Who'd like to go next? Radina?
Hi, I'm Radina. I sort of, little background, I sort of started like care when I was like 16 or 17 as a volunteer for med school. And then I really, really liked it. So I was offered a job and I took it. So I still do part-time like care while still at med school. And for me, like a typical sort of day as like in social care is sort of helping vulnerable individuals. We live in a residential dementia care home, so that's mainly individuals with like mental health problems. Like we normally provide like essential like services like emotional support is a big one, physical support if they've got any problems with mobility. Like Leslie said, you'd like sort of try and get them moving around. You're, like Leslie said, you're sort of like their family. But it is just that is sort of what a typical day is. You help them with feeding if possible, but it's very sort of tailored to the residents' sort of care plan and how their care plan is laid out. So it can be, my day can depend on where I am or who I'm with.
Thank you very much. And I see Lisa, you managed to join us. Lovely to see you on the call. I'm just asking people, what does working in care look like right now in your role? Would you like to have a go? Oh, I can't hear you. No, can't hear you. So if you try and sort that out while I ask somebody else to speak, okay? Right, who'd like to go next? We'll do one more and then we'll go to the next question. Sabrina? Thank you.
So my name's Sabrina. I've worked in care for 14 years. Started off doing home care and then moved into a care home. I've worked my way up and I am now a care home assistant practitioner. I don't know if anybody else has heard of that. It's basically a bit up from a senior. So I do medication, I liaise with doctors, kind of any kind of outside professional. I run the team on the floor. Yeah, so that's me. Love my job. I've always loved my job. I've definitely seen a change over the years from when I very first started, just because when I very first started, you know, people were chomping at the bit to get into care. You know, there were applications coming through the door. Whereas I think at the moment, we really struggle to find anybody that wants to jump into the role. That's not just here. I've experienced that in my previous jobs as well. I've moved around a little bit, so that's kind of all over. My day-to-day consists of, as I say, when I come in, medication is obviously the first thing I do. Then kind of handovers, we do meetings. I liaise with the staff on the floor to ensure that they're okay and don't need any extra support. Meetings with family members as well. Obviously, it's really hard because for me, going from a carer to a care home assistant practitioner, I don't really get to spend a lot more time with the residents as I like. So I do try and etch out a little bit of time throughout my day to get that done as well. Sit down, maybe a cup of coffee, or through dinner time, I'll sit with them and assist them. Yeah, and I don't think I'm going anywhere anytime soon. So that's me.
Lovely, thank you. Lisa, do you want to have another go? If you unmute. No, still can't hear you. Do you want to leave and then come back and make sure you click the connect to audio button, please? Lovely, thank you. Right, now, just by the quick show of hands, because it's a very much yes or no question, I would like you to raise your hand if you think you are a skilled professional. Dylan? Yay, nay? Yes, sorry, I wasn't sure if I could hear you. Thank you. Very helpful. Now, you are the people that do the work, really, every day, and you know what's needed. So, with the new government in place, what do you think is needed to reform social care so it's a better place for you to work in and a better environment for people to get outstanding or at least good care? Heather, could you try first?
Yes, I think the pay obviously needs to be much better. Rates of pay throughout care are horrendous for the work that we do. Also, I think training lacks as well throughout many care companies. And it's something that needs to be kept on top of a little bit more. In my role, I often visit I don't work in a care home, I work out in the community, but I do visit care homes if we've got clients in there that need additional assistance or they want someone for companionship. The company that I work for usually takes that on. So I witness other care settings. And from what I see, training is definitely not up to scratch. Even down to things like manual handling. I've actually had to intervene in a situation because there was something being carried out in front of me that definitely wasn't safe practice and definitely not the way that I'd been taught. So I think training is huge and really needs to be pushed, and people need to be refreshed on a much more regular basis. But again, it's hard work, and I think that the pay does need to reflect it. We go into it because we care, of course. We don't do it for the money. A real carer doesn't do it for the money. But, you know, we've all got bills to pay, and proper carers, the ones that really, really care and love their job, deserve a little bit better, because we really do put our hearts and souls and everything we've got into it. So I think mainly for me, it's the pay and the training process.
Thank you. Dylan, what would you like to see change?
Yeah, I think I agree with the person who just spoken, to be honest. I think a lot of the pay for a lot of the things that we have to do isn't the best. I mean, my friends or say people that I know wouldn't ever work in care, I don't believe. Obviously, I'm only 23. I don't think I know anyone else, even in my whole area, that does care at my age. So I don't think I can persuade anyone to even come into the role, but I do think the government, etc., do need to put obviously the money up, and then maybe people that do now might come and do a job. Obviously, like I said, I started care when I was 18, but I studied it in college, and it's just something I always wanted to do. I got diagnosed with autism when I was 11, so I thought there was no help out there for me when I needed it, so I went to go help other people exactly like me. Obviously, when I got to the job, in my head, I've gone thought I know everything. I'm autistic myself, but when you get there, it's not. Everyone's completely different. So yeah, I don't think. Like I said, I think everything's got to change. It'll be obviously the training and the money, I believe. That's what I think.
Lovely. Thank you, Dylan. Sylvia?
Yes, well, I just wanted to agree. Pay and benefits, I think it's very important. We have to be really appreciate more, and I do think that people really don't appreciate care workers because we are families, basically day-to-day basics. And also training is very important, because I'm lucky to work in the place I work in, dementia care home, and we have amazing training. We have very often, but I worked in community before, and I worked for agency, and we have agencies in the care home sometimes when we short of staff, and they coming, and it's very often they just have no clue sometimes what they're doing, and it's on us. So we have to show them, guide them and everything. But I think that they should have training, proper training, because they have people lives in their hands, hoists and stuff. That's very, very responsible, and we're struggling with that when people come in and they just don't know what they're doing. But it's not their fault. It's just how it is. They apply for the job, they get the job, and they straight away they send to work. And I think they should be more focused on that area. And what else? I think maybe support a little bit more mental health, because we can't help people when we're struggling as well. And as I think it should be some kind of sick pay as well. We never had a sick pay, and I don't really go on sick, but it's like, if we want to help people, we have to be well, and sometimes we cannot help them because we are unwell, and because there's no sick pay, we're really struggling, and because it's basically very often minimum wage, we cannot afford to stay at home, so we have to go and just do the job when we are unwell, and I don't think it's fair.
Thank you very much. Lisa, can we hear you now?
Can you hear me now?
Yes, we can hear you now.
I'm so sorry.
No problem at all. Right, we moved on to another question now, which is, what do you think with the new government in place and how things are at the moment? What do you think is needed to make your work life better so you can deliver even better care?
More funding, definitely. More access to things for people with support.
Okay, Thank you very much. Estella, could you share your views next, please?
Okay. I think I really agree with what Sylvia said with the sick pay and the more pay. If you're a carer, I do complex care. If you're a carer and maybe I'm taking the minimum wage, like complex care is a bit as it goes complex, and you get a minimum wage for the work you do. And you just look like, I've got a life to live, I've got work to do, yet the work I'm working doesn't meet my living, if it makes sense. Like, you're being paid, yeah, you can see you're being paid, but the money is not adjusting to the life you're living, if it makes sense. You get the money, it goes to bills, little is left for you. So if you're good, if you want to involve the youth in it, they're like, that doesn't pay that much for the work you do, because you're doing nights, you're doing days. So it's like basically a whole day for a whole week. But somebody doing a 9 to 5 job can be at work, close from work, let's say high pay, it's going to get higher pay. I am at work maybe 12 hours, 10 hours, 8 hours, but I'm not having that, like not getting that money, and my work is not attractive. Even if you're trying to get somebody into care, you have to talk and the next question they ask you is, what's the benefit? How much is your sick pay? How much are they going to pay me? What happens if I'm sick? And also with that, we need to be more appreciated aside the client. Some do appreciate, some employers do appreciate, but if I'm being appreciated, in what sense? Is it just an email? Oh, you're doing a good work. Oh, maybe employee of the month. What comes with employee of the month? What comes with you're doing more work? What comes with the improvement I'm giving to my clients? I've forgotten, someone said, we norm like carer, you're doing it from your heart, you're not doing for the money. If we all say we're going to do it for the money, I think for me, I think maybe I'll step back, because the work you're doing and the money, it's not, despite you have the heart to help people. When I see I've made improvement in somebody's life, I'm like, whoa, did I do that? And I get like, my confidence gets higher every time, but the money is still there, still the same thing. And if like introducing other things to make the work attractive aside money, maybe you can have a giveaway, a weekend away for one of your, so it's gonna, when my cousin sees me going on holiday, it's like, oh, is it your work that supported you, or is it your own money? If not a fully funded holiday, if not a fully funded weekend away, if not a fully funded shopping, maybe a 10% payment for a holiday, maybe 5% on our shopping vouchers will make the work. I think I'm speaking as a young girl, I'm just 24. So like, you see, I see my friends going on holidays, but they're not doing care. They have that kind of time and that kind of, I don't know, living, and it's not with the same, like, I don't know if what I'm saying makes sense, but
No, what you're saying makes absolute sense. So, with how much everything costs, the money that you earn for the job that you love, but you shouldn't be taken advantage of,
yes, I think,
nowhere near enough, especially compared to your friends your age.
yeah. And with the sick pay, you're sick, you do not want to fall sick, because you look at the sick pay, you're like, no, I need a healthy body, I need to be going to the gym, I need to be like exercise, I need to take care of myself, because when I fall sick now, the money is not going to even pay the rent or even do a shopping or something. I think they should look more into sick pay also. And yeah, make the work attractive. Can I take that? And the sick pay and incentives. Yeah, I think that's all I have to say for now.
Thank you. That was very helpful. And Clementina?
Hi, my name is Clementina, and I'm a domiciliary care assistant. So basically, we go into the communities to give care to older adults in the comfort of their homes. And I must say it's hard work. For other aspects of care, I see domiciliary care. I have done care homes, mental health, and domiciliary care is very hard. The fact that you get to drive each time, it's sometimes your back is hurting, it's killing. And what breaks my heart the most is the fact that I'm sorry, I'm being emotional saying this. The fact that you're being paid the amount of time you spend in a client's house. So you leave your house like 6 o'clock in the morning, you are not back till 10 p.m. and you're being recorded 6 hours. And you're telling people before the end of the month, you're already broke. You're looking for money. And they tell you, you work all the time. How come you're this broke? I think they should think about the fact that your shift starts at 6 o'clock and you don't get, of course, you get a break in between. But the fact that they just calculate the amount of time you spend in the client's house. I see it as when you go to give care to someone in the comfort of their home, they should pay for home service. If you get a hairdresser to come to your house to make your hair in your house, you don't pay the same amount when you walk into the salon. You pay more because they come to give you services in the comfort of your home. So also, I think domiciliary carers should earn more because they go to give care in the comfort of the client's home. Also, for our cars, basically, we do insurance, we buy fuel. Yes, they tell you we pay for your mileage, but that mileage cannot fuel your car. You're getting 20 pounds, 30 pounds, and meanwhile, you're using 17 pounds to fuel your car every week. Also, we should get discounts on insurance. 50% discount is not too much. If you are a domiciliary care assistant, when you're registering for insurance, they should get a lot of discount because they use their vehicle for the job. Yes, we're being passionate about what we do, but when you put in so much work, you work all the time, you are drained mentally, physically you're drained. It's just not encouraging at all.
Thank you very much, Clementina. Salvatore, I see you've raised your hand.
Yes. So Clementine, she said a lot of good points and everything, but and this is right. But I would like to say that I think that the government and should help to make some kind of compulsory information. For the first, the UK reimburse at 45p for each miles. So that means if my company pay me 35p for miles, I can apply for a mileage allowance to get the difference. So guys, I started with a really, I paid my second car £900. So when I came back for the 21st, so I was driving out with a wreckage, all fine, perfectly with MOT and everything. Then I discovered that. I discovered that because someone told me. So this is something really important to make a difference, guys. I've been doing with my second hand car in 1 year. I did 40,000 miles, guys, in a year. So this is no problem. I enjoy it driving around. As Clementine I say, started really early in the morning, finishing quite late. Unfortunately, I do not work until 10 o'clock. I will finish 8, maximum 8:30, because that is what our company decide for that and everything. But really, we got more that we don't know, and that this mileage allowance could help a lot if everyone knows. So guys, seriously, we can get a refund for miles. If you make any calculation for how much is that, and I've been able to pay with that difference, just taking the difference what I spend in petrol, taking out what I spend really for petrol, the difference between what I receive for that, for the petrol, and what I receive with the integration with the all allowance, I've been able to cover all the cost of my car. Okay, I'm not talking about the 900. So I pay another car a little more expensive of that. So guys, there are some information that needs to be spread and information. And right, we need to increase the pay rate, and that's supposed to be probably starting from the government, but with a protection. We're supposed to be a minimum with all national everywhere in UK. What I meant, okay, and then other information, the training. I think that we should have a minimum of compulsory from the government. We know that we have to do a lot of minimal trainings. We need to share. We got a syndication, but probably the government should take a handle on that as set a minimum of compulsory introduction, a minimum compulsory of training to understand. And we need to be covered for that. But I'm not talking just only as a carer, but as a company, because this is time. And every time that we introduce a new carer, we got a massive turnover of carer. And we need to be able to cover all these kind of costs, not as a carer only, but as a company as well.
Thank you very much. Would anybody else like to say anything about what is needed to make things better? Okay. Right, now I asked you earlier by the show of hands, do you think you are a professional? Now, by the show of hands, can you tell me which one of you thinks that your family considers you a professional? In your care worker role, Radina. Okay. What about friends? Okay. What do you think about the general public? Do you think general public thinks that care workers are professionals? Okay. Thank you for that. Worrying as it is, I agree with you very much. Right. I'm sure you all know, because it affects you the most in many ways, and that we are struggling with getting more people to work in social care for various reasons. So, as you are care workers and you do the job and you see people come and go, do you have any suggestions and ideas of how we could get more, especially young people, to come and work in social care, but not just for a year or two, but maybe for longer careers? Would anybody like to start? Leslie?
Yeah, I was speaking to some of the young girls who work within our team, 19-year-old and 24-year-old, and asked them, what enticed them to come and work in K. And it was like looking after grandparents and different things like that. They did have concerns about doing like the personal side of things, and they now realise that that was like just a fear that they'd like put on themselves. But one of their concerns, and a lot of the younger people have these black boxes where they're only allowed to do so many miles per year for the insurance. And I think that has a massive impact on them. One of the girls, she wants to go and, because we've got like what you call cross-team cover. We could go and support another team. But the mileage on that day is about 70 miles. And it just would take her over a limit because they've got a certain amount each year. And I think that needs to be looked at massively. And I think we'll get a lot more younger people in. We do get paid the 45 pence per mile by our company, and that's great. But obviously, when you're looking at things like that for younger people, I haven't got to count my mileage that way, but they do. And I think that's a huge part of it as well.
Thank you very much, Leslie. And as many years as I've been doing this, nobody has ever mentioned that before as an issue. So very interesting. Sylvia?
Yes, to attract young people, I think it has to be a balance, work-life balance. I've noticed this with working with young people straight after school. They don't want to work 12 hours every day. They want to have a life, which is, I think we like the new generation, they don't want to work as hard as the parents, which is understandable because lots of people are struggling with mental health. And I have young people at work, they don't want to work more than 6 hours, so they do half of the shifts and they want to enjoy their life. So I think it has to be balanced. Like, I don't know, it's just maybe I do three days, 12 hours, and then I have 4 days off. Not many people have these options, or they do have to work more. But I think especially young people, they have to be, so the company has to be more flexible with young people. They want to study, they want to do the care, but they have life outside, they want to school, they have friends. So I think they have to be more flexible. I think that's, yeah, work-life balance.
Thank you. And Radina?
I would agree with Sylvia because obviously I started when I was 16. I volunteered for like 2 years, like I said, and I sort of started working at around 17, 18 when I was in sixth form or college. But because I knew I wouldn't have the time to actively put like time into the job, they also didn't have quite a flexible like part-time hour contract either. So I have to do 0 hours, which I don't mind because there's plenty of shifts available. But I would have been on a more contracted role, such as part-time, if the part-time wasn't also doing like 20 hours or like 50 something 20 hours a week or something. So it's like the flexibility that I get being in like the age range between like 17 to 18 is quite difficult. And also when you're going into the job, you're sort of not thrown in, because I had thankfully like my care home to provide like all the relevant training and stuff, but you are sort of thrown in almost at like 18, 17, like expected to know the same level of stuff as someone who's worked in care at like 6 years, which as a 17, 18-year-old is quite daunting. Like you get like, don't know if it's standardized across the country, but my care home was quite nice, in which they said you get like 3 shadow shifts where you can watch someone and like, but maybe having like an initial training period that like increases the increment of the jobs that you're doing so that you can be helpful but not feel like a burden to like other carers because you just started out at like 18 would be quite helpful as well. Like the flexibility, like Sylvia said, at the jobs, especially for kids, not kids, but like teenagers who want to start, say, straight out of GCSEs because they don't feel like they need to go into like college or sixth form or uni or whatever, would be much more appealing. And the apprenticeship pay is quite atrocious sometimes. I think some people do like if my friend who works now, she's much younger than me, but like if my friend works now wasn't like enjoying what she was doing for like £4 or something an hour, she has to force herself to do the extra shifts, picking up overtime, because the overtime is the only way that she gets paid, like the actual standard wage. So at like 16 or 17, she's doing the apprenticeship full 7 hours and she has to do overtime for the full pay as well. So that's also a really, really big deterrent. Another thing is like implementing like a thing within like GCSE or sixth form or like college where people get to go into the communities and actually have some time like either volunteering or helping. I did it because I had to for med school, but I know for a fact that like it would be so beneficial, say like primary school kids, or like I know there's a problem with like the DBS and stuff probably, I'm not too sure, but like telling like in primary school or in secondary school, saying like you've got like a social week or something, and within that week like the school want you to have like pick between options of like going into the community and like for like an hour or two just filling in. Like it's like a requirement, you go into the community, you talk to like elderly patients in care homes, spend like an hour with them, and that you've ticked off your like role for that week. So giving an implementation where people actually don't look at care roles as like, oh, you're just like a maid, where people who do these jobs are not just people who are maids, they're trained in medication, they get like formal training, they go through like level something whatever's, and I want to be a doctor and I'm not doing as much training as people in care do. I do, but it's more on the like like learning aspect of it, instead of like carers who do like physical, like actual like levels of their training where they have to like increase the amount each time and make sure they're up to date with that training. So in my head, it's like, I'm gonna probably get more understanding, like if a sorry, I've switched there. If a resident sees me and I'm working as a doctor, I feel like, or if a person in the public was to see me and I'm working as a doctor, I would have more respect probably than a carer that's been with them like throughout probably several years, and who knows them probably way better than possibly the doctor does. So implementing that in a population, in especially the younger population, would be like quite good to like improve like just what people think about it, give them a reason to want to go into care homes and like actually just see the lifestyle. Because for some people, they really like this job, but they just didn't want to do it because of how like taxing or like how negative like people portray it and how the media portrays it. So yeah, that's what I wanted to say.
Thank you very much. Very helpful. Lisa, I saw you nodding along. Would you like to say something?
Yeah, I totally agree. I just think that they should promote care workers, support workers better. We're not promoted. We're just made out like we wash people, put them to bed, so on and so on. We're not, you know, I'm trained in peg feeding, I'm trained in giving midazolam, I'm trained in all sorts of things like that. And people just think that I wash and clean people. We go out on community, we do physiotherapy, we do hydrotherapy. And to everybody, it's just, oh, she's a carer. Where if you went in schools, colleges and promoted that we go swimming, we do rebound therapy, we do hydrotherapy, we do physiotherapy, we go out on community, we do beach buggies. You know, maybe younger people would want to join in and be a support worker, you know, and when you do all these things with people who, when other people say they can't do that, they can't do this, and you take them out and they're on a beach on a big buggy and you're like, you know, the smile on their faces and your faces are like, who can't do it? So yeah, I think we should promote support workers and carers a lot more in colleges and school, and maybe let them come out for a day in a day centre or a care home and see what they do. You know, and we're not just someone who gives someone a wash and a cup of tea.
Thank you. I'm getting tearful now. I was a carer for many years myself, and it's honestly the best job I have ever done, and I do really miss it.
Yeah.
So I spend every waking hour trying to make things better for care workers, but it does hurt, doesn't it?
Yeah,
It really
yeah. I mean,
hurts
I've done this.
people's
I've worked in day centre for like 8.5 years, and before that, I worked in nursing homes. You know, and I've done it for like 20 years now or something like that. And it's just, I wouldn't want to do anything else. You know, I've just become a team leader after being here 8.5 years, so I'm kind of getting used to this side of it. But I miss being out on the floor, and yeah. So. And yeah, I wouldn't want any other job. I love it. And I wish a lot more people would come in and love it too.
And understand it.
Yeah.
Dylan, you came in quite young into the sector. Do you have any ideas, apart from what's been mentioned, that would help getting more young people and men as well into care?
I think the main one, obviously, everyone's already said it, it's being educated. But I don't know, I mean, like I said, it's because of my background. Like, I've written books on obviously my life and stuff to obviously help other people. Again, like my friends, if I said to my mate, come work at my place, that like they all think it's great. Like you get to go to the cinema and stuff. But there's days where like we've been to the cinema and it's like on behalf like I don't know, one of the service users is attacking me right in front of the cinema. I mean, it's good going to a cinema, but then when you get in an environment with other people looking, and some people make it worse sometimes. So then obviously when you come out, we've had people like get involved, and then you see other people my age thinking I could never do a job like that, and it just looks worse, but it's actually the community that make it worse. So it's like, it's just not educated enough, and I think that's one thing that we do need, because everyone else is like, oh, I can never do anything like that. Or say, when I was in school, like I said, I was bullied. So you got people like, oh, he's a retard, I'm a retard and this and that. Years down the line, we've all grew up, and it's like the person who'd called me a retard is now working at my place. And I'm sitting there thinking, well, how come you working here? Like, do you not remember this? Do you not remember that? And in the end, it's just they're not educated. So it's like when they grow up, they end up having children themselves that might have some type of learning disability or any disability. So then they get involved in the job themselves. And it's just people need to just be actually educated on it. And it's not, you're not this, you're not that. It's just who we are. So yeah, that's basically just education, I think.
Thank you very much. Aselo?
I think I also I liked what Dinah said, and to add up to that, to what also Sylvia said with the life and balance, sometimes as Dallin said, they need to educate the public or other people that care work, as Lisa said, is not a made job. I'm giving medication. I'm being trained to take care of like complex care, do peg feeding, tracheostomy, everything. And somebody's just gonna see me like she's a carer. I'm like, yeah, I'm a carer, but it's a job. It's a professional job. Everybody sees care as like a side job. You need the money to do something, but doesn't see it as like how you're gonna see a nurse. Oh, she's a nurse. You never get that reaction. Oh, she's a support worker. It's always like she's a support worker. Sometimes some of us don't wear uniforms, yeah. So you have your tag on and you're with a service user and people are looking at you like, that's the maid, like that's an accomplice. They don't see us as a professional. They see us like she's got nothing to do. She's just in the care. Like care job is seen like, I don't know the word to use, but it's like you've got nothing to do. No job wants you, and you're just there to pay your bills because you don't have any job. And sometimes you need a career project like progression. If they want it to be, if you're in the care work for a year or two, there is a certain exam you can write, then you level up. Then like a rank, like something. Some of us can be support worker forever. If maybe you don't get other dimensions or get any other diversity, is that like the support work. For some people in the care homes, they get the, I don't know how to put it, they get the progression, but some of us don't get the progression. So I'm gonna do that job, do it. It's just the support work. There's no, although I'm doing trainings, unless you're like, I want to divert into maybe phlebotomy, dentistry, nothing. But can we have maybe a support work where it's different, not just one thing? Like we have complex care. Can we have maybe a carer who is in dentistry, a carer who is in like, so on the field, we don't get nurses. I know nurses are needed, district nurses are needed, but if the care has like different, I'm a care worker, what do you specialize in? I'm a dentist care worker, or I don't know, because I do not really know how the health system or the education system in here is. Maybe for me, not to bring my country's thing in, for my country, if you're health assistant, you're being trained on all aspects. So anything a nurse can do, you can do, but you have a limit. And we are all health assistants, but there is a community health assistant and there is a clinical one. So there's a clinical person, I'm at the hospital, and there is one who is also outside, like the community doing her thing. She cannot intrude in my business. She's just gonna hand over to me like how we hand over to the district nurses, the other nurses. So I think different aspects in the care work can help, and maybe career projection can also help with the younger ones for some of us. But for my agency, it's really nice there. They get to appreciate you with the little things. If you have to move further, you have to be trained. You need to be trained before you come on the field. If you're not trained, they're not taking you. If that helps. Okay.
Yeah. Thank you very much. Very helpful. And Sabrina?
Yeah, so I just wanted to kind of agree with what everybody else was saying, but also kind of add a little bit in. So it's perfectly fine, you know, doing application forms and getting all of these young people in. But I think just needs to be a bit more insight into kind of the different things that we have to deal with. You know, obviously like DBSs and training and everything, you get kind of 3 months, 4 months down the line after introducing this new member of staff, and you take them up onto the floor, you know, and they're on a dementia ward and you have quite severe dementia. They're seeing kind of like fully grown blokes coming at them, you know, and I know I've taken a couple of rib jabs and a couple of back slaps and whatnot from, you know, from a bigger bloke. But you're talking about the younger generation. I've known it for, you know, 10, 14 years now. So I know how to deal with that type of situation. Whereas I think if you've got a new starter and they've gone up into a dementia ward and this gentleman's coming at them screaming that he's going to kill them, that just completely blows everything out of the water for them. And then the next thing you know, you've got their resignation on your desk. There's absolutely no kind of training until you're in the job and maybe kind of a couple of months down the line that gives you any insight into the side effects of quite severe dementia or Huntington's disease or any of the more progressive diseases that you deal with within the care sector. It's okay going into a residential home where, yeah, fine, you know, let's make a cup of tea and we'll have a chat and we'll watch something on the cinema. But when you come into a nursing home and you're dealing with all the different types of, as I say, dementia, etc., and the outbursts that these people go through just for sheer lack of capacity of what they're actually doing, out the door goes the new professional, and out the door follows them with their friend that they brought on after they started because they thought the job was great. I feel as though maybe you know, some books or some videos or whatever needs to be put together to give these new starters, old or young, you know, because we've taken new people on recently, you know, and these people are kind of like the older generation because that's how it is. They've got no idea that in 3 months' time they're going to walk into a 12-hour shift and they're going to get smacked in the face because Rogers decided he didn't like their look today, or, you know, Brian's decided that he wants to go home and he's going to pay somebody a £5 to take him to the taxi rank, but they're not going to, so he gives them a jab. I feel like a little bit more needs to be put into that side of care. Definitely.
Thank you very much, Sabrina. Clementina, is there anything you'd like to add?
Yeah, so a couple of persons has talked about balancing. So in my own opinion, I think for younger generation to think about working in a 12-hour shift, that's a lot of time for them. If the shift pattern carrying 8 hours, 6 hours shift, whereby they get to decide the days they want to be on long days, they would want to look into working in care more. And also there are some companies that I'm happy about this platform where you want to hear about the workers, because most of the time you see organizations that are for the service users. So not so many organizations are for the workers to want to know their pain, what they go through, because there are some companies that, I don't know if extortion is the right word to use, they'll make you work 6 days in the week. So no young person would want to work in such company and say, I'm not going to have a life if I work here. So there should be organizations that would also look into, yes, they have the CQC regulation that also would supervise those companies, look into what their workers are going through and probably adjust it if they need to.
Thank you. Very helpful. And Heather, we've got a minute or two if there's anything else you'd like to add.
I just really agree with everything that's been said. I think about the balance, the work-life balance. It's the way that care companies advertise their jobs, you've either got to be available from a 7 till 7 or a 7 till 3, and then it's you know, a much sort of later shift, and young people especially don't want to do that. Even people like me, I'm a single parent, you know, there isn't a nursery that opens at 7 o'clock or prior to 7, because I'd need to get to my first call, say, at 7. And, you know, it's sort of demanded that you do every weekend or every other weekend, but the pay rate stays exactly the same. And companies don't really seem to care about their staff and their lives, you know, and the fact that actually they would like that balance. And if you give your staff member that balance, you're going to get a better carer out of them. But I don't really think that matters in the care sector, to be honest. I think it's a lot about the bigger people making a lot of money, rather than what the people on the front line are actually doing and what they're going through. And people don't seem to understand how important we are. We're seeing people potentially, you know, within the last years, months, weeks of their life. We're the people that are going to be there to make much more of an impact than even possibly their closest family members. So it's really, really, really important as to who people employ. And I think a stricter interview process as well needs to be in place, because as I said earlier, I've seen carers that have walked into the job and I wouldn't want them with my family members. I wouldn't want them looking after me when I get to a certain age. There's an awful lot that needs to change within the care sector and for the workers, especially because they are overlooked massively.
Thank you very much, Heather. Thank you very much, everybody. That's it for our time today. But not the end of our discussions with you and other care workers. This week, we're launching a new project of an advisory board for care workers and a champions group for care workers that's being funded by the RAIN Foundation. And we're really looking forward to having input from some of you and other people into our work, but mainly into what actually needs to happen in the sector, because you should be the people that have as big of a say as people who draw on social care in this conversation. So just to reassure you, at CWC, we do every day fight your cause, whether it's training and pathway and career progression and pay differentiation and pay and sick pay. We think of it, we talk about it, and with the new government in place, we're pushing that as well, obviously. Thank you again so much for your time, for all of the hard work, incredibly rewarding, but still hard work for relatively very little money, or very little money in any sense. And I appreciate you sharing some things that are incredibly difficult to talk and think about and upsetting, because they are so incredibly unfair. So thank you again, and have a lovely afternoon. And we'll let you know when this goes online as well. So if you want to share with people, you can.
Thank you.
Thank you. Thank you.
Thank you.
Thank you, guys.
Bye.
Thank you.
Bye-bye.
Thank you.
Bye.